What is post-void residual volume in bladder care? Have you ever wondered how much urine is left in your bladder after you go to the bathroom? This is where post-void residual volume comes into play. Post-void residual volume, or PVR, is the amount of urine that remains in the bladder immediately after urination. Ideally, after you empty your bladder, only a small amount or no urine should be left. Measuring PVR is crucial in bladder care. When there is an elevated residual volume, it can indicate issues with how well the bladder is emptying. This could be due to various reasons such as bladder outlet obstruction, weak bladder muscles, or even neurological disorders. High PVR levels can lead to complications like urinary tract infections and frequent urination. So, how is PVR measured? The most common method is through non-invasive ultrasound scanning. This technique uses sound waves to create an image of the bladder and estimate the volume of urine left after urination. Another method involves inserting a catheter into the bladder after urination to directly measure the residual urine. While both methods are effective, ultrasound is often preferred due to its safety and convenience. For adults, normal PVR values are generally less than 50 milliliters. However, values up to 100 milliliters can still be acceptable. If the residual volume exceeds 100 to 300 milliliters, it may indicate significant bladder dysfunction, which requires further evaluation and treatment. In the context of bladder health and bladder cancer, monitoring PVR is particularly important. It helps differentiate between various causes of urinary symptoms and guides treatment decisions. For instance, if a patient has elevated PVR, it might suggest bladder outlet obstruction or impaired bladder contractility. These factors are crucial in managing patients with bladder cancer or other urological conditions. Additionally, keeping track of PVR can help assess how effective treatments are in improving bladder emptying. In summary, post-void residual volume is a key diagnostic tool in bladder care. It measures how much urine remains after urination, helps identify incomplete bladder emptying, and informs treatment strategies. If you have concerns about your bladder health, it is always best to consult with a healthcare professional for personalized advice.